Hello, everyone, and thank you for joining today's discussion on the topic of healthcare accreditation. We're very excited to be able to present this to you. My name is Wendy Danicourt, and I serve as the head of the healthcare accreditation at American Accreditation Association, or AAA. It's a pleasure to be here with the group of professionals and people who are interested in learning about the healthcare accreditation. And I feel that you all share the strong commitment to raise the standards of healthcare quality. We do have a very diverse group, so I'm excited to see what kind of questions that we will be able to answer for you during this presentation, as well as there is a Q&A button on your screen that you can use to submit questions that we will answer at the end. And if we don't get to them during this time allotted, I will send responses to you after this presentation. So something I just want to share, accreditation. This is something that impacts everyone, not just the healthcare professionals, but the patients, payers, and your communities. So we feel that it's very important to pay special attention to healthcare accreditation. Also, today, I'm not just going to talk about the healthcare accreditation, but here to invite you to be part of something bigger, the role that you could possibly play at promoting accreditation that will have direct impact on improving healthcare outcomes, strengthening patient trust, and ensuring hospital, clinics, and providers operate at the highest level of quality and safety for those in your communities and clinics. So kind of who we are, what we're going to do today is talk about who we are, why accreditation matters, accreditation versus certification, what's our process with healthcare accreditation, what does a successful accreditation look like, the benefits of accreditation, and future of accreditation and your impact. And as I said, we'll have times for your questions. So please, I encourage you to submit questions in the chat at any time. Dima, who is on with me, she is monitoring those for me. Thank you, Dima.
Most welcome. I'm all here.
Yep. So who is American Accreditation Association? Well, we're an organization that is internationally recognized, accrediting body. We have international offices in London, as well as our headquarters here in Virginia, United States. And we are operating globally in 52 countries. We've done some amazing work with organizations, and we have a broad range of services that we provide for accreditation, not only healthcare accreditation. So our strategic objective, we have a number of divisions, and we want to provide international accreditation that inspires confidence in quality of products, services, and acceptance of results from accredited organizations, and the protection of health, safety, and environment of the public that goes across the board for all of AAA. We also promote the acceptance of accredited results, certificates internationally and amongst global partners. And we continue to strengthen our operations team, developing the capacity and capability to exceed the expectations of our customers and stakeholders and deliver accreditation services to the highest quality and technical standards. We'll talk a little bit more about that and how we are what we pride ourselves in doing and how we're a little bit different than other accredited bodies. So some of the other accreditation services that we provide are, besides healthcare accreditations, we do school accreditations with the Department of Education Standards, laboratory accreditations in those certain areas, training and education provider accreditation, criteria for institution and program accreditation, inspection bodies accreditation with the ISO IEC 17020, and certification bodies accreditation on that. So we are a very well-rounded organization when it comes to accreditation, and have experience not just in healthcare, but other areas. And those other areas may impact your healthcare, hospitals, clinics, and organizations that you work with. So if you have any questions, just let us know. We can expand on those services with you individually. So with healthcare accreditation, we are members of ISQUA, ISQA, International Society for Quality in Healthcare. And really what we're trying to do there is reach for the highest quality possible in our accreditation, consulting, trainings, and with our partners in healthcare. We look at providing outstanding patient care is something that we highly value and that we want every patient to experience. And we feel that through accreditation that we are able to promote the high quality care. And having AAA accreditation attests to your commitment to excellence regarding of the type of business you're running, whether it's dialysis, day surgery, private clinic, polyclinic, dental treatment, which is one of the specialties we have here, ophthalmology, community pharmacy, or medical travel, also known as medical tourism. So really anyone involved in healthcare and looking for accreditation should give us a call, because we do have some very specialized areas that we work with, and not just hospitals, but we do hospitals as well as the clinics. Our standards that we were approved through ESQA were developed to ensure that your program met the highest quality and social care requirements, allowing you to create greater trust and respect in the clientele. So why does accreditation matter? So let's get really down to why it matters. Why is it so important? Accreditation is not just for regulatory checkbox to meet what government or other entities say that you have to have, but it's a powerful tool for your organization to improve patient safety and clinical outcomes. You'll see that that's a theme throughout this training, but also it builds trust with patients and stakeholders. We enhance staff training and performance, gain a competitive edge in the healthcare industry. And that's not just through being accredited, but having that proof that you're doing the best quality care, and that some of your competitors may not have that accreditation and hold their standards quite as high. But this is proving that you've had an outside person, group, entity come into your organization and review information from top to bottom to ensure that you are providing that quality care, meeting the highest standards possible, and that you put the quality and the patient first. It also has a financial impact on that as well, with accreditation having positive impact to that, and creating revenue streams for your organization as well. With the regulatory checkbox, it does check that. So working with your government, your payer requirements that require you to have some type of accreditation, we would help you meet and exceed those standards. And one of the interesting studies have shown that accredited hospitals have lower infection rates, reduced medical errors, and higher patient satisfaction scores compared to non-accredited facilities. And that also plays into your financial impact of any fines, any fees to address infection control, the errors. And with higher patient satisfaction, you're going to have that reputation in your community and have more individuals come to your organization, thus increasing your financial impact. So I'd like to do a quick poll to ask, whoops, sorry about that. Do a quick poll to get your impact and your feedback on what you think the biggest challenge is in achieving accreditation. So let me put this poll up on the screen, and if you would be so kind to respond, that would be great. Well, and just all right. So if you could just answer the first question, that would be great. I'll just give you a few moments here. Well, thank you so much for participating in that poll. That is, it looks like we've got majority of the folks are having staff training and engagement as one of the highest challenges, and then cost after that, and then time, and then meeting standards, then time commitment are the answers at this time. So those are very interesting. Very interesting responses on that, and I'm happy to say that with us at AAA, we can offer a solution for those challenges with the staff training. We'll get to that in just a moment, but thank you so much for sharing your feedback on that. Oh, so with accreditation, I do want to share that there's often a question of what's the difference between accreditation and certification. So accreditation is really a comprehensive evaluation of your organization, and overall quality, the governance of your organization, and patient safety. Where certifications focuses on specific programs and services or individuals within the organization. So the accreditation does the full umbrella of what is impacting care, what is impacting your organization operational processes, what is impacting the governance of your services. So the overall, where certification then focuses on specific programs and only specific. So if you get accreditation, we're looking at the programs as well and who's running your programs and the services, but we're looking at the entire organization, whether it's a large multi-million-dollar hospital or a smaller clinic, outpatient clinic that is just starting up. We can provide the best quality of that. So for accreditation, as I just said, a hospital accredited is the overall healthcare. Certification might be a specialized stroke care program, certified for excellence in neurology services on that piece. So just another quick poll that I have to see if anyone is currently accredited or certified. And you already answered some of those, so thank you. So we have almost half of the organizations online as being accredited, and about 10% are certified, and others not yet. So that's exciting that you're still looking at possibility of becoming certified or accredited. And we at AAA would love to help you become accredited as an organization. So what does accreditation look like at our organization in AAA? We pride ourselves in keeping it streamlined and helping you through each and every step. So what we want to do is talk about the key steps here. In preparation, that is the longest step, getting prepared, showing that you have that commitment that you want to become accredited. And then what does that entail? That entails looking at your standards for the accreditation that you want to join and achieve, comparing those standards to what you are doing throughout your organization, and how you have that documented, how the staff are aware of the standards, why the standards are important. So typically that takes anywhere from 3 to 9 months, depending on where you are in your development. If you've gone through accreditation before, it might be closer to the 3-month mark. If you've not done that and you're just starting out, it might be closer to the 9-month mark on that piece. And what we can do with AAA is that we can help you with that, and we'll get to that on the next slide. But then after you get prepared and you've gone through that, you've done your trainings with your staff, you have your documentation in order, you're feeling very confident that you're meeting or exceeding the standards, then we have a documentation review. We try and streamline this so our surveyors don't have to read the documentation while they're on site. So we ask you to upload certain documents as is important and pertains to your specialties, so that we can review those. And if we have any questions, we can get those answers before we come on site. And that documentation review can take anywhere from 3 to 5 weeks. And we pride ourselves in being closer to the 3-week mark on that. But if there's items that still need to be developed and worked on, on your end, it might move on to 5 weeks. So we have our document review, and then we have our survey. And with the survey, we are offering both on-site, come to your organization, as well as an online survey that we are able to do, or a hybrid survey. And with the survey, we have a surveyor as well as an observer participate, so that there are at least 2 observations and feedbacks available to you for that survey. And the survey length typically takes 1 day, yet it should be noted that depending on the size of your organization, as well as any disbursement. So if you have any other multiple locations that we need to go to, how easy is it to go to those locations and organize that? We work with your schedule so that we're not interrupting and disrupting your patient care and your services. We don't want to do that for sure, but we will need someone with us, whether it's online or in person, to help facilitate getting information that we need, clarification. And I just want to reiterate, the survey is not, an accreditation is not a focus on what you're doing wrong, but really what you're doing right and where are there areas of improvement. And we know in today's world, things are changing all the time. So we're learning from you as much as you're learning from us on possibilities for improvement. And we love to see that because of the impact it has on quality, the care, the outcomes for the patients as well. What you can expect from your survey as well is a brief feedback of what the surveyor found. It's not the official feedback. The official feedback will come 2 or 3 weeks after the survey, because we take it to a larger committee to review to ensure that any areas that we identified are consistent and that we are all in agreement. So our accreditation committee reviews that. We give you a full written report so that you can have the accreditation decision, and that decision could be a full accreditation for 3 years, celebrate on that. It could be a conditional accreditation where there's might be some things that we need to see addressed before we can, and once we see that it's addressed, we can give you the full accreditation. Or the accreditation could be denied, but that's not one of the things that we want to have happen for sure. So one of the things that, as I mentioned before, is at AAA, we pride ourselves in helping providers become accredited. And with that, what we see is we provide enhanced support and advisory services. We know that you're investing in your staff. As we mentioned before, part of the challenges is the staff training and preparation. So we can help you with that. We have consultants that are fully aware, very educated on the standards, as well as providing healthcare services so that they can help you with the trainings and preparation. So that will result in a faster and fewer corrective actions accreditation review on that. We have a lot of resources available. We have surveyors from across the globe so that we can provide insight and input to that piece. And at AAA, we are also very adaptable to help you with your needs and what you need and how to help you with what is happening. We typically, when you apply for accreditation, you have 12 months to achieve accreditation. But again, if the past 5 years haven't taught us anything, life is ever changing, so we can be adaptable in that. We want to make sure that we're in alignment with you on what you want to achieve and how you want to achieve it. So you will get an accreditation officer who will be your individual point of contact to help you clarify anything, identify needs, help coordinate if you are looking for consulting, looking for trainings on that. So we're highly involved with your accreditation process and checking in with you a number of times through this process to make sure you're on point if you need any resources, and helping you put everything together so it's a successful accreditation. On that, we can help speak with your leadership to make sure that there's a commitment and that accreditation is seen as a positive throughout your organization. Looking at encouraging staff to embrace quality initiatives, patient-centered focus, putting safety and outcomes first. We can help with those types of trainings on that. So what I can say is when we have leadership involvement and there is an accreditation, that is when you get the buy-in from your staff to help you make the accessible experience and continuing the accreditation standards throughout services. It becomes a natural part of your care. And through that, then you decrease any fines or penalties you might have for non-compliance. The patient retention rates increase because, again, it's a cohesive environment with healthcare. And possibly more access to partnerships and healthcare opportunities on that. One of the I was asked when I've done this before is to share a post-accreditation example, and I can speak to a hospital that was struggling with their patient retention and just being efficient in their operations. They decided to pursue accreditation, and within a year they saw a significant drop in the patient complaints. They saw increase in their physician and their staff engagement, which was very large because those are your biggest resources to champion what you're doing. And they received a 15% revenue boost because of improved billing and accuracy and the quality of care. So that was very exciting for them. So hopefully AAA healthcare accreditation could have that impact for you as well. So what are some of the benefits of becoming healthcare accredited? Well, I've been talking about those throughout, but some of the, again, is higher quality of care and outcomes. We do a lot of tracking and tracers to see the experience of the patient, which then is very enlightening to know what is happening well, what is not happening well. We have the regulatory compliance aligning with legal and industry and governmental standards, which is very important. The operational efficiency and performance, as I just mentioned in that small little sharing of a case study, is it could have an increase in the revenue. It can also help you streamline what you're doing operationally, and identify what is needed, and if there's anything that you are doing that you thought was needed but wasn't quite needed. So streamlining is very important on that. Increased credibility and trust among staff throughout engagement and accountability. I feel like this is one of the biggest things that impacts the quality of care and the outcomes, is when you have trust amongst your staff and engagement amongst the staff, that then impacts your patients and their care, and they see that it's a cohesive and that you're upholding the highest standards possible, and gives them a bit of relief when they're coming in for healthcare. So that's very important, makes them feel safer. And there's been surveys that patients do feel safer in accredited organizations and facilities. And we talked about competitive edge, that being accredited when your competitors are not will show you at a higher level of standard, access to the reimbursement and revenue, keeping patients engaged and they keep returning back. That'll increase your revenue, but getting new patients and referrals from those positive outcomes and feeling of being taken care of is an important part, and accreditation helps create that environment and that standard and expectation. So let's see, we had a poll question on this that you've already answered as well. Which benefit of accreditation is most valuable to your organization? And we got 50% at patient safety. So I applaud all of you on that. And then regulatory compliance comes close in there as second, which I get. You have to have the compliance part as well. But to put the patient safety, and really regulatory compliance was created to support that patient safety also. So excellent. Thank you for sharing your information on that. So we're at the future of AAA healthcare accreditation, and really the healthcare landscape is always evolving, and we want to keep accreditation on pace with that. So what we've started doing is creating partnerships not only with healthcare providers, but with other consultants to promote, support, and assist in healthcare organizations being accredited through AAA. So keeping the community updated on trends is something that we provide, trends knowledge, trainings, newsletters, webinars. Digital transformation is a big part of what's happening in today's world as well. Patient-centered care. So that is the focus on designing everything around the patient point of view without creating undue impact on the process and the healthcare clinical services. AI, so AI is becoming a large part. They're already looking at what standards there needs to be, the ethical issues on that. So we are keeping our eye very close to that part. Medical tourism is also a large business coming up, and we are helping organizations with that. And by medical tourism, we see that individuals coming from other countries to your organization for services, and how can you meet the standards that they expect from their country and your country as well is an important piece on here. New, and then we're proud to present that we're creating the AAA Academy to have trainings online, in person, and bring more knowledge to healthcare organizations and help you meet your needs. We heard from the poll earlier and in the chat, I saw that seems to be a challenge, is getting the training. So we're finding solutions for that as well on that piece. So we're very excited. Healthcare accreditation is not just about coming in and reviewing how you're doing, but helping you meet those standards, achieve, as well as helping set the standards and expectations. So again, going back to outcomes, quality, patient safety on that piece. So we see that we have a lot of things to address on this. And we are looking at how you can participate and contribute as well. So for those of you who haven't gone through accreditation, start that conversation in your organization, invest in the staff, and partner with industry leaders to stay ahead is an important piece. And for those of you that might not be in a healthcare organization and you're still wondering how you can participate, how you can bring accreditation to your area or your communities, look at educating decision makers, bringing AAA accreditation to the forefront in boardroom discussions with your governments, with any payers that you have, any stakeholders, other hospital administrators, clinics, policymakers are important. Speak to your network about promoting accreditation in your industry and how it's important and how it can impact the patient care and patient safety, as well as financial and operational services. And really acknowledge that accreditation is not a burden. It is a competitive advantage. It is showing that you're going above and beyond and that you're doing what you're saying and taking care of your patients. And that AAA accreditation can increase patient trust, reduce errors, open doors for new opportunities. And that by promoting accreditation, you're setting a higher standard for patient safety and quality care on that. Another way to become involved is we are at AAA. As much as we would love to be able to get our message to all the communities, we know that that's not possible. We are working with individuals to help spread the word in their community and help get organizations in their community accredited through consultation. So we work with outside consultants as well as our own internal consultants, helping with the trainings and getting the clinics, healthcare providers involved and helping spread the word and connecting us, AAA, healthcare accreditation, with the healthcare centers to help them become accredited. We do have partners and, as I said, consultants that we work with. So if you're interested in that, happy to talk to you about how you can become part of the team and work together, our partnership on that piece as well. Sorry, the chat box is just booming. Lots of chats coming in on there on that piece. So how am I doing on time? Okay, so we do have some upcoming events coming up. We actually have, as I was mentioning, our consultants. We are always looking to add to our consultant training, consultant team, sorry about that. So we're pleased to announce an upcoming online training for individuals interested in becoming consultants with AAA healthcare accreditation. The program is focused on providing you with knowledge and skills to guide the healthcare organizations in your community on a path to accreditation and the benefits of AAA healthcare accreditation. Some of the highlights, it's got a comprehensive curriculum covering all aspects of our accreditation standards, the process, value proposition for healthcare providers, expert faculty leading experts in the area, some that helped write the standards, that are very involved in the standards. And as I said, we're a global team, so we have a wide range of viewpoints, so we can help share that so it is applicable to your area on that. Interactive workshop, it's going to be engaging sessions designed to enhance the understanding of consulting skills. Also, it's networking opportunities to connect with fellow consultants and people of like mind. There'll be a certification, become a certified AAA healthcare accreditation consultant, so that even if you're not working with an organization and we get contact from someone in your area, we can reach out to you to help get you involved as well. And really who we're looking for are healthcare professionals with a passion for quality improvement, patient safety, individuals seeking a career in healthcare consulting, professionals interested in promoting AAA's healthcare accreditation in their community. So if you have any questions on that, please reach out to me and we will be happy to share that information on the training, or if you have questions, or if you have more questions on what a consultant is, what does that look like, we'll be happy to explain that and go into further detail. But really, I think this is an opportunity to invest in your professional development and become a champion for healthcare quality by joining our healthcare compliance consulting. I might be a little biased because they're a wonderful team to work with, and so kind and caring on that part. So let me see. Oh, I'm running right on time here, so that's good. Let's see if we can get to some questions and answers here.
Yes, we do have many questions
I
here.
know, I see the chat just going, so.
So we have, let's go to the questions that they are here. So question number one for you, Wendy, is there are any fees for courses?
Fees for the courses. So there are, depending on the course. So the course that I just spoke about that will be coming up in the next month and a half or so, that is a 3-day course, and then there's a test afterwards, and that is $500 for that course. Other trainings that we may have, that varies. I'm sorry to be so vague, but it varies on the type of trainings, what courses you're looking for. Happy to talk specifics to anyone who wants to, if you want to drop me an email to give you more information on that. But yes, and because we have some courses that are already created that can be that are online. We can create a specific course for your organization that you're looking for. Such I see this one, courses for quality. We do have some pretty in-depth courses on quality, from how to track, how to trend, what do you look for, what does quality mean. So yeah, drop me an email. Happy to discuss and try and find a solution. So for hospitals, and for any clinics, what we do with our standards is we look at what services are you providing, what type of provider are you, and we provide you an outline of which standards are applicable to your organization specific. So our standards manual, sorry about that, is pretty intensive and pretty in-depth. So we don't expect people to meet every single standard, because that would not be applicable, such as dental providers would not need to meet the same as some of the surgeons in ophthalmology. So we are happy to say that we've identified the specific areas that apply to all, and then We ask upon your application what type of services that you provide, what type of facility you are, so that we can, when we share the standards with you, we can tell you exactly which standards for you to focus on. Thank you, everyone. Have a wonderful day, and I look forward to your emails, or wonderful night. Yes. Thank you.
Bye-bye.
All right. Thank you.